Hi, everyone. I'm Paul Grand, CEO of MedTech Innovator. Welcome to the third and final event in our 2021 Leaders Forum series. We'll also be having an in-person event on Friday that I'll tell you about in a little bit. I want to start off first by just recognizing the Leaders Forum and make sure everyone understands what we're doing here. The Leaders Forum was established in 1995 with the aim to raise funds to prevent and to cure diabetes and improve the lives of everybody affected by it. This is an incredibly important event, so welcome, and I'm glad that you're here with us today. Let me begin by telling you a little bit about our sponsors for today. This event is sponsored by a number of companies, the Life Science Angels, Moss Adams, Wilson Sonsini, Goodrich and Rosati, my own company, MedTech Innovator. We've all been supporting this event for many years, and this is what makes the event possible. As I mentioned before, this is a really important event in terms of donations. We're very lucky this year. We have a donor who has stepped up to do a one-to-one match for all donations in November up to $25,000. So you can double your impact by donating. All you have to do to donate is to either go to diabetes.org/leadersdonate, or you can scan the QR code that's here on the screen. So take out your phone, take a quick picture. It'll bring up the website and you can donate. It's that simple. So very important that you understand, again, how this format works. So we have a discussion that's going to be happening today. We've been doing expert discussions all this week. And today's panel discussion is on the state of health equity in California. Our moderator for the discussion is Martha Clark. Let me tell you a little bit about Martha. Martha Parry Clark has global experience that spans the asset management, health nonprofit, banking, strategy consulting industries. For the ADA, Clark serves on the national board and is the chair of the Audit and Governance Committee, and served previously as the interim CEO, as well as chairs of the Community Leadership Board for the San Francisco Bay Area. Clark is also the co-chair of Project Redwood, a funder of innovative solutions to alleviate poverty. So I hope you enjoy this discussion. I'm going to hand it over to Martha to introduce today's speaker.
Thank you, Paul. Really appreciate it. I'd like first to introduce Judy, who I've gotten to know a little bit, but I'm really looking forward to getting to know her a little bit better today, along with all of you. I want to thank you all for joining us. Really appreciate your time and energy on these really important issues. As president and CEO of the California Wellness Foundation, Judy leads its mission to protect and improve the health and wellness of the people of California. She uses her vision and her voice to help Cal Wellness, quote, level the playing field so that everyone has access to healthcare, quality education, good jobs, healthy environments, and safe neighborhoods. Belk is a seasoned leader with more than 25 years of senior management experience in philanthropic, government, nonprofit, and corporate sectors. And before joining Cal Wellness in April 2014, she served as senior vice president of the Rockefeller Philanthropy Advisors and as vice president of global affairs, public affairs at Levi Strauss & Company. She's a frequent writer and speaker on organizational ethics, race, and social change. And she blogs regularly at the foundation's website on issues related to its grant making and its public policy priorities. She currently serves also on the board of Cernda Foundation, a national New York-based family foundation, and Hedgebrook, a women's writing retreat in the state of Washington that promotes women's voices and social change. I'm going on and on because there's just a lot, Judy. She's an advisory board member for the University of California Firearms Violence Research Center, the first state-supported institution of its kind in the country. Belk received her undergraduate degree from Northwestern University and her master's in public administration from Cal State University, East Bay. I will stop there. That's a very...
Thank you. It's so uncomfortable, Martha, kind of sitting, listening, saying, who is this person? So, but thank you. I'm so excited to be here and to lend my voice and support to the American Diabetes Association. You know, Martha, I was just looking at your background, and I saw that you're involved with Project Redwood. Is that Project Redwood with Stanford University?
Yes, it is. It is. It's an alumni grant making
Yeah,
organization.
I believe that everyone is connected, and so the connection with Project Redwood is when I was at Rockefeller Philanthropy
Yeah.
Advisors.
Yeah.
We helped launch Project Redwood, which is a great donor collaborative. So I just had to mention that. It is great to know that that effort is still going on.
And thriving. Yes, yes, yes. Well, thank you for your efforts there. So I thought maybe we could start with your background a little bit on a more personal front. Tell me more about yourself and your work at California Wellness Foundation.
Sure. Well, first of all, my story started as so many Californians had outside of California. I was born and raised in Alexandria, Virginia, outside of Washington, D.C., before it was the tourist destination. And I made my way across the country. And most of all of my professional career has been in California, working in the space for common good. I actually think I now have the best job in California. I've been leading the California Wellness Foundation for over 8 years. We are a health conversion foundation, which, interesting enough, is kind of one of the fastest growing types of foundations in the country. Our roots were almost 30 years, which makes us sort of a baby when you compare it to the Rockefellers and the Fords. So we're sort of adolescent, but our roots started when HealthNet, an insurance company, which was a nonprofit, decided that they wanted to be for profit and go to the marketplace to raise capital. And when that happens, the state usually steps in and says, well, you can't take those benefits that you got as a nonprofit with you. So we opened our doors with an endowment of about 800 million. Our endowment now is about 1.2 million. Our focus is really clear. Our North Star is the social determinants of health, which is just a fancy way of saying that people can't be healthy or well without taking in where they live, their race, their economic level. So our focus really is on really trying to level the playing field, to get resources to Californians who are trying to get that American dream but fall short because of the communities they live in, because they don't have a living wage and others. It's a great job.
Aren't you lucky? That's wonderful. I hear you're a big fan of stories, and I'm actually quite interested in one story, which would be, do you have a personal reason for getting involved in this whole mission in California? I'll tell you my story if you'll tell me yours.
Yeah, okay, I'm interested in your story. I'll tell you mine. I started off talking about my background because place is really important as we look at health equities. I mean, there are folks that live 10 miles apart in the state, folks who live in the west side of LA. Life expectancy is very different from folks who might live on the east side. And my story really illuminates that sense of place. I grew up, in the shadow of the nation's capital in Alexandria, Virginia, in a historical African American community. But for the first 10 years of my life, I didn't have access to water or to indoor indoor plumbing. So that sense of place has stayed with me as I think about health inequities across the state of California. There are still pockets of California that don't have access to clean water. There are still folks who just, based on where they live, can't have access to health care because of their immigration status and the income. I mean, the state has so many resources, both in terms of human capital and dollars, and still there are folks who, as you know, don't have access to housing, they don't have access to adequate education, or can't fulfill their dreams. They're neither healthy or well. And so, because I've really personally experienced racial and social injustice, I know, I mean, for the first 10 years of my life, I was not dreaming as a child should be about maybe going to college or what I wanted to do with my life.
Right.
What I was praying for every night was, can I have a bathroom? Can I get, access to water? That was it. And so that has stayed with me. And it also has reminded me about the power of philanthropy. I was able to go to a school in, my neighborhood. When I started, I wasn't allowed to go because of the color of my skin, but a group of philanthropists, primarily in the Jewish community, actually funded a lawsuit to make sure I got into the school. And then, my parents didn't have any resources for me to go to college, and it was really philanthropists who gave me the opportunity to get a college education.
Right.
So I feel and still remember the sting of racial and social justice. That is the reminder that I have, even though I'm sitting in this job with, $1 billion in assets. And I also understand what the power is of philanthropy. I mean, we can't make our way out of racial and social justice, but every day, our board, our staff, we get up every day trying to get resources out to California to level that playing field.
Right. So you come to this from your personal history. I also come to it from my personal history.
Yeah, tell me a little bit
very different.
Tell me
story
about yours. Tell me your story, Martha.
Well, for me, both type 1 and type 2 diabetes are like throughout my family tree, everywhere.
Okay.
And I myself have lived with type 1 diabetes for 46 years now. So I wasn't called to this from some unusual. It was very personal to me to start working with the American Diabetes Association. But I seem to double down my commitment every year, not actually because of my personal connection, but as I learned what the American Diabetes Association was doing, I started to realize that there were millions of people out there who were trying to thrive as I was, which is very difficult with diabetes. It takes a big part of your mind share. And to also have poverty on top of that and all the barriers and obstacles that come with poverty, it made me want to kind of double down my commitment every year in terms of volunteering. I don't like waste, and I think the enormous cost of this disease to our system, the lost years of health and life, the lost productivity due to illness, that lost mind share that I talked about, and then the compounding of that for poor communities and for people of color, just it infuriates me. So I'm in this mission out of a real desire to make even just a small contribution to solving that problem.
Well, you're making a huge contribution. It's interesting you said that last night I had a date night with my husband, who is a physician working in a community health center, and he's really dedicated his life to really trying to provide health care to underserved. And he shared with me that, type 2 diabetes and hypertension are the two areas which are preventable, but are so linked to economic and health inequities. And it's frustrating to him because with, people had access to fresh food, if they had access to just health care or even to, primary care or prevention, it could make a huge, huge difference.
Right, right. Well, following the stories theme, I'm wondering if you have a story that might illustrate the dire need for more health equity in California.
It's a story that we're all living, Martha. It's really the story of a global pandemic. You know as well as I do that even before COVID, you just shared thoughts. There are Californians that were barely holding on. There are folks who had underlying health issues such as diabetes, hypertension, and others. They didn't have jobs that could sufficiently support their families. They didn't have access to Social Security. They experienced discrimination because of their immigration status. Didn't have access to basics, which I'm beginning to think human, access to Wi-Fi is a human right. So just think of those folks, and then also think of folks who might be disabled and others. They're barely holding on. The pandemic hits. So just think about the impact on folks who are barely holding on. They might they didn't have a choice of being sheltering in place like you and me. They had to go out and work because they didn't have any other resources. Their kids are at home and are doing their homework on, maybe, a cell phone, trying to do that. Maybe they're living where they can't separate themselves or be safe or whatever. Or even if they have a job, they were laid off, so they now don't have access to health care. So those are stories, and the tragedy of it is the loss of lives. Over 700,000 Americans. Included in that is a family member of mine, a first cousin, which is in our family, first cousin is like an extended brother, Dino. I say his name to just remind he was, essential worker, and he was one of the first casualties. He died alone in a hospital in Alexandria. He felt he didn't have any choice, that he had to go out and work and expose himself. There are millions and millions and millions of these stories across the country. So COVID really shot a spotlight on the health inequities, not only in California, but in.
Yeah, I agree with you. I think COVID has sort of laid bare for all of us the reality of these health disparities and inequities that we've been talking about for years. Sticking with COVID for a minute, then, I mean, we've got an audience, or this is a forum full of technology people. So let me move to some technology questions around COVID. On the one hand, health technology actually has been a savior for many people. It's enabled care through telemedicine in a way that was not really taking off before COVID. If in my world, continuous glucose monitors are much more prevalent now. On the other hand, it's pretty clear from all the data that's come out at this point that COVID has also kind of widened the gaps in access to health care, because people haven't been able, and disproportionately those poor workers and minority communities have been accessing their regular health care much less frequently than other populations, for example. So their access to these health technologies and healthcare has gone down. There's all this wonderful innovation, and yet, and it strikes me that many of these innovations are coming from private companies. Mm-hmm. You've had a lot of experience in the interface between public and nonprofit and government, kind of working to solve these problems. Have public health agencies kept up, or they've been late to the game here?
I wish I could be a little bit more optimistic. I think in addition to COVID really laying bare the inequities of the human needs, it's also laid bare about really system breakdown in terms of our public health system. And I think it caught many folks as a surprise. I think those of us who, work in the public health field are not surprised. We were ill prepared on so many levels. Partly related to technology, but just honestly investment also. A couple of things that it gives me a little hope. One that just happened yesterday with the bipartisan signing of the infrastructure bill. I'm thrilled to see that there was a broadening of really understanding of infrastructure. Sure, our roads and our bridges and all of that are important too. But the fact that broadband is included in that, really looking at water, my staff laughs at me because I am such a softie for anything that's helping to get people access to safe and clean water, because I experienced 10 years of not having access to water. So I would like to think that those resources will fall in the hands of folks that can really think about the human needs and innovative technology to also drive change. Where I'm optimistic about that. I'm equally optimistic about the bill that will also provide needed social resources that's being negotiated also around childcare and around other safety nets that are really, and within all that space and all those resources that are coming from government, Martha, I can't imagine that we can't, and we have to also use kind of some of the best minds around, technology and innovation. Bottom line is, as someone who has worked in government and business, in a startup social enterprise, and now working in philanthropy, we are going to need the smarts and the talents and the skills and the resources of all of those sectors to drive on what I get up every day trying to think about of how do we lift those Californians who deserve to participate in the California dream. How do we get them to be supported around getting resources to them, innovation, technology, and we're open to supporting any of those efforts with that goal.
Great. So you mentioned the success of the bill that got passed yesterday, but Can you share a story of success in health equity, perhaps in California, in recent years?
Well, the biggest, I would say, again, because I think government has to be a part of it, Affordable Care Act was a game changer in the state, and California really was the poster child of showing what the impact was. You have to realize that for 25 years, Cal Wellness, as well as other philanthropic health funders, we've been putting resources in, trying to get more people health care. We don't have the resources that government had. If we needed really good public policy to make it happen, and then government, philanthropy, community-based organizations, and even the private sector then pulled together in California to expand healthcare. So that's a transformative example of a public policy, with the implementation being with the other sectors. And even then, when it was approved, there was a huge number of Californians who were not included because of their immigration status. And in recent years, California has used its state resources to cover children who are undocumented, and most recently just passed a regulation or a legislation to cover those who are undocumented that are over 50. So we're slowly, all of those are public policy issues where government has to, has to be in the game. So to me, that's the most transformative piece, that is health.
Right. It strikes me that California is a very difficult place to be doing this work that you do. It's one of the most, it's a densely populated state in some respects, and it's an incredibly diverse state with more indigenous people, it turns out, than any other state in the nation. There are more than 13 million people in California who have diabetes or pre-diabetes. It's an enormous number to deal with, but it has the highest cost of living in the U.S. And 1 in 3 people in this state live below the poverty line. You kind of put all that together, and it's a mix for real issues. In your work, what do you find are the greatest barriers for California that prevent health equity?
Yeah, I try to look at things as both the barriers and the assets. One of the assets that we actually talk about is being a California-based foundation. I mean, if you look at the resources that are in the state, it's pretty incredible in terms of technology innovation, in terms of dollars. I think we have some of the most gifted, most innovative nonprofit leaders in the state. We have a state government that has been willing to lean in on many of these issues and have been partners. And there is a sense of collaboration. So let's start with kind of the assets. So we have that. I would say the barriers is that we have not come up with a system to share those resources in an adequate way. Income inequality is, it's not because we don't have the resources in the state, it's because we've not been the will to really understand the importance of sharing. So income inequality is one of the major issues, and race. Racial injustice. We're one of the most racially diverse and if you look at the stats, the data, and we're a public health foundation, so data is really important to me. If you look around all of the indicators, folks of color are hurting the most, are the poorest folks in the state. So there's that racial issue, and I know I do a lot of writing around race, and someone sent a note to my board chair saying, "Can't she just stop talking about race?" And I wish I could, but race is unfortunately racial injustice is an indicator of whether or not you're going to be healthy or well in the state. So we have a lot of work, to do in that arena. I think the other thing that we're spending a lot of time thinking about is this is a very geographically diverse state. I mean, I'm amazed. It's a huge state, and resources, including philanthropic resources, are not adequately distributed in terms of rural communities in the Central Valley, in the Inland Empire, in places like the Imperial Valley, all of those folks. And we, the philanthropic community, needs to do a better job, but we need to be really thoughtful about how we can also work to support and look at the geographic divide.
Interesting. You talked about kind of the rural versus more urban split. I understand you live in both, or you live and work in Northern and Southern California. So you split time between the two. Is there a difference between Northern and Southern California?
Northern and Southern, but we're a statewide funder. We give out about $50 million a year in grants, and so we're trying hard to get dollars in high need, underserved areas of the state. And that's the far, far north, the Central Valley, the Inland Empire. Those are areas, and so when the one thing that's been very frustrating for me is part of the job I enjoyed the most is getting out to the community and seeing. So one of my last trips was before we shelter was out to the Imperial Valley, which high need, but not having the resources they need to do with environmental injustice and living conditions. So I think Californians, and this is where I would say the philanthropic community also falls short, is really pushing resources out to underserved areas of the state. Right. And I think there's some opportunities there for technology and innovation also.
Right. So I'd like to talk for a few minutes about a health equity platform called our HEN platform at the American Diabetes Association, Health Equity Now. For a moment, we are partnering with very large corporate organizations like Walmart, Baxter, Abbott, a number of others, to do a series of efforts in local communities. Often, a community-based discussion takes place and we build something right around the needs of that community. But it's focused on access and differentials in access to trials, to clinical trials, to care, to affordable technologies and medicine, access to some of the upstream issues, appropriate healthy food, and access to a peer-to-peer community to help learn, all of those things, because all of those things are necessary to address diabetes. And it's our heartfelt view that if there's so many people with diabetes and we have the classic chronic disease that's self-managed, that if we can solve some of these problems for people with diabetes, we're really creating systemic change for the system. But when you think about those things, clinical trials, access to care, what are the greatest challenges in California that you think need to be addressed for to address health equity?
Well, really, for me, it does really go back to, I know I sound like a broken record, but the issue about, income inequality, people having a living wage, government policies that really, really get resources in the hands of those who often have been left outside. One of the things that I've also shared with you that I really tried to do is to use all of our assets here at Cal Wellness. When people think of philanthropic organizations, they often think of the grants that we give out, and we do give out about 50 million. But I am also sitting on $1 billion of assets. And so I've been spending, and our board spends as much time thinking about how we can align our endowment, getting capital in the marketplace, which can support our mission and goals. So I think there's a document on this platform talking about our mission related investing. So any of the entrepreneurs in the audience, should really be familiar with foundations like Cal Wellness, who are saying we really want our investments to fuel innovation and impact, and really look at opportunities to change who has the capital and how do we use it to focus on getting resources, getting capital, getting housing, getting innovation. Most large foundations are able to use program-related investments, which provides the opportunity to use part of our endowment for loan guarantees, for equity investments. So that's a huge area that we're really working on, and we're really trying to get most of that, a lot of that investment in the hands of women and investors of color who have been on the sidelines and working really hard in that arena. So that's a huge area that the philanthropic community, at least we're pushing around mission-related investment.
So let's talk about health technology for 1 minute, but I want to remind the audience, if you have a question for Judy or myself, but mostly Judy, if you could put that question into chat, I think it will get to us, but we'll talk for another 5 minutes or so and then see if there are questions we can answer for the audience. I'm sort of interested in any advice you might have for the audience members who are looking at innovative ways to build health technology, in terms of how they can do that in a way that really does impact the future of health equity. I'm reminded of a course at Stanford that I found fascinating called Design for Extreme Affordability. And it took the idea of, it took the engineering school, medical school, the business school, put them together in a class and said, let's look at the marketplace as individual consumers, in Burundi, in places that don't have very much money, make it extremely affordable. Take something that was $200 and make it $5 in something that an individual could make, because these people don't have the safety net that we have. What we're talking about is largely the people that fall through the safety net.
Right.
So thinking about health technology and how it might help to solve the future of health equity, how do you think that can contribute?
Well, I am not a tech weenie, but I can tell you, as someone who has to sign off on every major investment that we make across a variety of assets. My advice, and I was just on a call with a roundtable of other CEOs of some of the largest foundations in the country yesterday, who share how Wellness's belief that on the investment side, we want it to be aligned. First of all, when we get recommendations from our investment advisors, our goal is that we want to do no harm in terms of our investments. So investments that we're most interested in are ones that will have the kind of social impact that are in line with our mission. We also, who we invest in is really important. So we want to know, does the investor, does the manager really share our approach to a commitment to diversity? So we often want to know, tell us who's on your management team. A low-hanging fruit is the commitment to ESG, and then impact. And so when I think of a great model, I think of Darren Dotson from Aluminum Capital, where we're a major investor, is where his fund to fund includes that anyone who participates in fund has to go through racial bias kind of training, who really is clear about looking at investment opportunities that really are looking for social impact. So that's really important, to us. We're trying to do our part in telling our investment managers who go out and find these deals that we want to be sure that they're opening the door to give a shot to new and emerging entrepreneurs, to give them a shot, because what we're hearing is they often, we have these great ideas, Judy, we've got this great innovation, but we can't even get in the door. So we're trying to look at ways to get folks in the door. And for example, we've just set aside $50 million targeting women and diverse managers of color. We've made a tremendous progress. When I came in 8 years ago, we did not have one manager of color in our portfolio. We're now up to 43%.
So we've got some questions starting to come in from the audience. There's one general one. Exactly where can they learn more about the social investments at Cal Wellness? You've given us an overview, but how do people learn more?
Well, one, I think we did put what our total journey was on a slide deck that I think is on this platform. And I think if you're interested in finding out more, you can send me a note, and I will put you in contact with our investors.
Right. And another question that came in was whether you are offering grants to early stage startup companies.
Yeah, we are. We do it in two ways. One, we talked about program related investments where we provide investments to sometimes below market rate return and new, but in our portfolio it's pretty diverse in terms of early stage, but we've also really looked at opportunities to provide equity investments in early stage in our program related investing portfolio.
And someone would like to know, are you going to be at the Leaders Forum Health Tech Showcase on Friday?
I won't be, but I'll be there. I will be there in spirit.
Good. So I thought we could begin to wrap up with, first of all, a kind of what are there any words of encouragement you could provide this group of innovators who are listening to us today? Anything you would like them to leave kind of being hopeful about and inspired about?
Sure. I can't think of a more crucial time than the time that we're in, where we need all of the innovation that we can muster, all of the smarts that we can, whether it's in government, where it's in the private sector, in philanthropy or nonprofit organizations. So I really would encourage you to really think about how you can set yourself apart in terms of a competitive edge. In terms of philanthropy, really, I would encourage you to really think about attending programs at the Mission Investors Exchange, other places where both those funders like us and investors come together and increase your understanding of program-related investing, mission-related investing. Would encourage you to read Inside Philanthropy and the Chronicle of Philanthropy, which really covers also mission-related investing opportunities. I think as you think about putting together your team of advisors or your boards, that you think about having some community representation, maybe having a community advisory board to tap into that. So I would say there's billions of dollars floating around the philanthropic space, and you should know that in some cases we for some investments, especially our program-related investments, we make capital investments, and then we also, in some cases, will make grants for TA exceptions. But really, what I have found when I talk with new investors or new entrepreneurs, they are really very unfamiliar with the philanthropic sector and the possibilities.
And with that, I'll put my pitch in. If they want to become familiar with the American Diabetes Association, we are always looking for volunteers to help with our advocacy, both in Sacramento as well as in Washington, with fundraising for our research programs, with volunteering for our Power Up program, which goes into communities, particularly disadvantaged communities, to kind of teach children and families together how to live more healthy lives, and a whole variety of other programs and efforts. The ADA is always looking for people who share our passion. So I would like to really thank you, Judy, for everything you do, but for joining us today and helping to put a set of stories and face to this issue, which can be really daunting to understand, incredibly hard to positively affect. And I just am personally inspired by what you do. So thank you so much.
Well, thank you. And mutual gratification to the American Diabetes Association and to you, Martha, as a committed volunteer and work in this space. I want to thank you for your leadership.
My pleasure.
Well, that was a terrific discussion. Both Judy Belk and Martha Clark. I mean, I learned so much in that last hour, not just about the California Wellness Foundation, which is incredibly amazing. I didn't know a lot of the background, certainly in your background, Judy, was great to hear, and what drives you in your mission. But just learning about health equity and the opportunities for people to get involved and how to think about philanthropy. I mean, there was so much to unpack in there. I wish we had another hour. We're gonna have to continue this offline because that was really fascinating. So again, thank you so much, Martha, for moderating, and thank you, Judy, for sharing so much information and resource and inspiration for everybody. So we really appreciate it, and looking forward to continuing to learn more.
Thank you.
All right, so everyone, again, I want to remind everybody that if you enjoyed today's discussion on health equity, if you enjoyed learning about the American Diabetes Association and some of the things that we're doing to advance not only health equity, but of course the mission to cure diabetes and to provide better lives for people who are involved in diabetes, whether they're patients or whether the people who care for them. This is your opportunity to donate and to be part of that mission and part of the opportunity to really make an impact on lives. You know, that's what this is about, is making an impact on lives. So I want you to look down again at or look to the side next to me for that link. That's diabetes.org/leadersdonate. And also you see a link on the screen to diabetes.org/leadersforum. So first, let me tell you a little bit about that. Again, so the diabetes, the American Diabetes Association Leaders Forum has an event every year, which is a health tech showcase. You heard a lot today about innovation and health technology, and we have 40 plus companies. I think it's actually close to 50 companies that we selected out of hundreds of applicants who are going to be presenting this Friday in San Francisco. So November 19th from 10 a.m. to 1 p.m., you have an opportunity to meet some of those innovators you were hearing about today. As I said, up to 50 companies, I think, are going to have tabletop showcase exhibitions. These are amazing companies. I can speak personally to the fact that 20 of those companies are MedTech Innovator alumni companies, and those companies were vetted out of thousands of companies who applied this year. So amazing companies going to be there. If you're involved in any way in innovation, whether you're an investor, whether you're a provider, a payer, et cetera, if you're somebody who's even a patient, if you're involved in innovation, this would be a great opportunity to meet some of those innovators, get to know them, see how you potentially can get involved, whether it's supporting them financially or just being part of the company in some way. So it's a great opportunity to meet everybody. It's going to be in person in San Mateo this Friday, November 19th. If you go to diabetes.org or www.diabetes.org/leadersforum, you'll find all the information about that event. Again, you can scan the QR code as well if you want to make a donation. So that is also at the link of diabetes.org/leadersdonate. So I highly encourage you to do both of those things, to donate, and I highly encourage you to join me as the MC on Friday for the showcase that I mentioned. There'll be a ton of great people there to network with. in addition to the innovators I just mentioned, there'll also be lots of investors and other people who are part of the industry, strategics and so on. And we have a competition. So out of all the companies that applied, we selected 3 companies. It was actually the Life Science Angels who did the hard work of reviewing all the companies and then actually choosing ones to present in a competition that we're going to have. There'll be a $10,000 first prize. I'll be emceeing that competition, and the audience will be choosing the winner. So you can be part of that as well. So I hope you'll join us this Friday, November 19th at 10 a.m. I hope you'll donate to support the American Diabetes Association. And we look forward to seeing you, hopefully not only this week, but in the future at our Leaders Forum series in our upcoming events. Look for us on LinkedIn. You'll find information about, you can just search for Leaders Forum. You'll find our profile. You can follow us and make sure that you stay in touch with all the things that we're doing. We have sessions like this throughout the year as well. It's not just this week. So that's the overview of what's coming up. Really appreciate your joining us today. We appreciate your supporting diabetes. We appreciate your listening to the story from the California Wellness Foundation. And I encourage you to reach out if to both Martha Clark and Judy Belk if you have questions about that in the future. Amazing organizations, and really happy to have their great sage wisdom today. So thanks again, everybody, and hopefully I'll be seeing you on Friday. Please reach out to me, Paul Grand. I'm on LinkedIn if you want to find me if you have any questions. Thanks again, and look forward to seeing you all soon.